thanks for joining us. You're watching Health Matters. I'm Renee Rouse with the Florida Department of Health in Martin County. Our mission for this show is to give you important and urgent information that affects the health and safety of you and your family. Recently, the Florida Department of Health in Martin County launched its Community Health Improvement Plan, or CHIP for short. The plan was developed after a series of meetings last year with numerous community partners discussing the most pressing health issues impacting Martin County. Information gathered from these meetings was analyzed and areas of focus were identified. Promoting the importance of school health and securing extra staffing for the program was identified as a priority.
And cover one eye, okay?
In this episode's big story, we'll show you what school health nurses are doing to keep students healthy and learning to their potential. We'll also share with you details of an upcoming increase in staffing levels. Another focus of the Community Health Improvement Plan is promoting education and awareness of health and human services.
This is our resource center.
In this episode's Health Spotlight segment, we visit with one of the best and perhaps most underused free resources in the county that is just a phone call away, dialing 211. And finally, it's that time of year again in South Florida, the rainy season. And that means mosquito season. In our health calendar segment, we'll remind you of ways to protect yourself to keep mosquitoes from breeding and biting. But first, it's been well documented that healthy children do better in school. Oftentimes, school nurses are the only medical professional that a child may see. That's why what they do in the schools is so important. I recently visited Port Salerno Elementary School and had the chance to see in person the great things that nurses are doing to keep children healthy.
Okay, Angel, we're gonna check your eyes and ears today, okay? Your teacher wanted me to check your vision and hearing, so have a seat right here, buddy.
Jennifer Bracken is touching lives every day.
Have you look right at this little light. You'll see a little blinking light.
As a school health nurse for the Florida Department of Health in Martin County, she is on the front line of student health, helping to ensure that students are healthy and ready to learn.
That's our ultimate goal, is to have kids be physically present here in school, to have them be feeling well enough to participate and to learn to their fullest capacity.
Jennifer has been a school health nurse for almost 20 years and has seen a change in the variety and complexity of health issues among students.
We have more kids with chronic health issues, like we've seen spikes in life-threatening allergies, for example, and the research is still kind of pending why that might be. We have an increase in our number of diabetic students. As we know, obesity is a problem for the whole country, you know, Florida, Martin County, and as one of the side effects of obesity can be early onset diabetes in children.
You may think of a school health nurse as someone that gives out a bag of ice for your bruise, but they do so much more. School nurses oversee and manage state-mandated screenings for vision, hearing, weight, and scoliosis. They teach classes on nutrition, emergency safety, and puberty. Nurses also review all health records, including immunizations, and develop emergency action plans for more serious health conditions.
We have many children with medical and emotional and behavioral challenges that are in everyday classroom with everybody else, and so all teachers really need to be aware of how to care for those kids and their medical needs.
Nurses also help students and families find resources and help navigate what can be a complex system of medical care.
We help families to apply for Medicaid. We refer them to social service agencies that can assist them with housing, food, clothing, child care, job placement.
With only 8 registered nurses to care for over 18,000 students in 22 schools, each nurse has to split their time between 2 to 3 schools each week. But those numbers are about to get better. Thanks to the support of the Children's Services Council of Martin County, 2 more nurses and 1 support staff person will be added in the fall of 2016, improving the nurse-to-student ratio. And really, this can't come soon enough for some children, as the school health nurse may be the only health care provider that child will see.
As a parent, you want to know that your child is safe in school, and when you have a very scary condition like a seizure disorder or diabetes going on, you want to know that someone there knows how to deal with a medical emergency. And cover one eye, okay, and then you
For Jennifer and her school health nurse colleagues, it's all about working to improve the health and educational success of students, one child at a time.
Martin County provides many services to its residents, but sometimes wading through loads of information to find something specific to your needs can be difficult. But what if there was one simple phone number you could call with a live person on the other end that could help answer almost any questions you had about social services? And it was free.
Let me get you that number.
In this episode's Health Spotlight segment, we sent Bob Hoganson to the Martin County 211 call center to show you this easy and free service.
So it's very sad. It's a very sad situation for you because you want to get along with your son, but
Everybody needs a little help every now and then.
Okay, and how many people are in his home?
Call takers at the Martin County 211 Resource Center know very well how much a friendly voice on the other end of the line can mean.
From people needing rental assistance, electric, to maybe a teenager had a fight with their parents and they just want to talk.
Belinda has been a community resource specialist here at 211 for 5 years. Her goal has always been very simple: help people in need.
It is very rewarding. We might get 100, 200 calls, 300 calls a day, but I think that as long as we feel that we've provided resources and we've provided assistance to our callers, we feel it is rewarding.
So Sharon, this is the nerve center of the whole place here, huh?
It is. This is our resource center, so this is where the staff are available to answer calls. We have live people here 24/7. When someone calls in, we've got a staff person to help them.
Sharon LaRue is the Director of Programs and Services for 211. She says that specialized training, along with a vast database of resources, allows callers to the helpline to get information on just about anything under the sun.
Using what we call active listening and then just probing and assessing, and then we match people up with the services that are going to fit. So if you're having trouble finding a job, then we're going to look for job resources for you.
In addition to giving out helpful information on social services, the center is also equipped to handle more serious situations like abuse and people contemplating suicide.
Our employees are trained to de-escalate and to talk to people and walk people through those kinds of really serious issues as well as those day-to-day issues.
And that's not all. New programs are always coming online, like the recent Help Me Grow initiative. If parents think their child is not developing at an appropriate rate, they can call and get an over-the-phone assessment. There are also programs for the elderly.
It's called a sunshine call. We call and check on them every single day. So if you have a loved one that's older and you'd like us to check on them, we can do that for you.
Thank you for answering all those questions. Let me get you that number.
The call center has been active for almost a half-century and receives about 100,000 calls a year from its 5-county service area, including Martin County. But Sharon says she still feels people don't know about the free resource.
It's so easy to just dial the numbers 211, and we have staff that really care, live people that care about you.
So she says give 211 a call first to get specialized local information. And if you don't want to talk on the phone, no problem. You can text your zip code to 898-211 and a specialist will text you back. You can also reach the service center by going to their website, www.211treasurecoast.org, and clicking the chat box. You can also send an email to help@211.org and someone will respond to you directly.
well, the only thing that you might want to do is
As for Belinda, being able to lend a helping hand when people are most in need is what it's all about.
We always make ourselves available at the end of the call. You know, we're here 24/7. Any questions that you have, you can call us.
And finally today, with the summer rainy season comes mosquito season, and that means it's time to start taking extra precautions so you don't get bit by mosquitoes.
Mosquitoes will bite day and night, so protect yourself with these tips. Keep mosquitoes outside by shutting doors and covering windows with screens. Use EPA-approved insect repellents anytime you're outdoors. Cover your skin with long sleeves and pants. Mosquitoes lay their eggs in water. Just a bottle cap of water is all they need. So drain, refresh, or cover anything around buildings that can hold water at least weekly, and put away outside items that aren't being used. A message from the Florida Department of Health.
That was a PSA produced by the Florida Department of Health. We are all responsible for helping to keep the mosquito population down. As you saw, it takes only a small amount of water for these creatures to breed. In this episode's Health Calendar segment, Bob Hoganson visits with Martin County Mosquito Control and shows you the many things that you can do to protect yourself and your home.
We get a lot of calls that there's mosquitoes flying in through my front door and I don't know where they're coming from. And we'll come out, and so we go to the entryway first.
We recently tagged along with Martin County Mosquito Control Specialist Steve Noe as he checked for evidence of mosquitoes at this home.
There's some sort of planter. And so you see here, there's a little tray underneath this little plant. It's empty, which is good. So there's no water in it, but a lot of times any plant or pot that has a saucer underneath it and you ignore it, the Aedes aegypti mosquito will always find it and breed there.
The Aedes aegypti is mosquito control's enemy number one. The pesky insect can carry dangerous diseases and is very smart. They lay their eggs in areas known to fill with water. In 1 week and in as little as a bottle cap of water, these creatures become flying insects. Noe says it's up to all of us to limit their breeding potential.
Well, when it's been dry for so long, we tend to forget about all the containers that we've left outside. When we get the heavy rains or any good shower, those things will fill up and we don't pay any attention to them, and then within a week you've got mosquito hatch-offs.
It didn't take long to find a major source of mosquito breeding on this property.
First thing that caught my eye is a 5-gallon bucket over here.
Any container, especially buckets like this, are a mosquito's favorite place to lay eggs.
This bucket actually has yard debris and water in it, so it's been missed. And sure enough, we've got a cup full of Aedes aegypti mosquito larvae here. And you see them all wiggling around in there.
If not dumped out, these larvae would turn to mosquitoes in about 24 hours.
Florida bromeliad, they're everywhere. People love them.
Another common place to find larvae around Martin County is in the cup-like leaves of the bromeliad plant. They can fill with water from rain or sprinklers. What can you do to protect yourself from the mosquitoes breeding in these plants?
Well, there's two things you can do with bromeliads. You can either take a hose and flush them out with fresh water once a week, or you can get, this is what mosquito control uses, it's called Alticid. They just shake it all around into the bromeliad, and this will give you 30-day control.
The Alticid larvicide is harmless to plants, animals, and humans, but the granules will inhibit the growth of mosquito larvae in water. A common spray fogger is also very successful at knocking down the bugs.
Spray that, wait about 10 minutes, come back out, and you can garden. You're going to have way less mosquitoes.
From recycling bins,
these plastic lids will definitely hold water,
to gardening supplies. If not managed, you, the homeowner, could be contributing to the problem. And what's interesting is that the Aedes aegypti are really homebodies. They will only venture about 100 feet away from where they were born. So if you see a mosquito at your house, chances are it was born in your yard or your next door neighbors.
You know, they'll hide wherever they can until there's an opening in the house, and then they move right in.
It is so important, especially during the rainy season, to check all your property. As we saw, even something as simple as a recycling bin can hold enough water to breed mosquitoes. So make sure you check your property to protect yourself and your neighbors. For MCTV, I'm Bob Hoganson.
Thank you, Bob. It seems every year there is a new disease that we're concerned about that comes from mosquitoes. Several years ago, it was dengue fever and chikungunya. Now it's the Zika virus. For more information about Zika, log on to the Health Department website at www.martincountyhealth.com. There is also a Zika virus information hotline available by calling 1-855 622-6735. Well, that wraps up this episode of Health Matters. In this show, we introduced you to the people keeping an eye on your children's health while in school. We also learned about the free services available by dialing a simple 3-digit number, 211. And finally, we learned how to keep your house free of standing water and help keep those pesky mosquitoes away. Thank you for joining us today, and remember, your health matters. I'm Renee Rouse.